All right, guys, let's be real for a minute. You've got that caring instinct, that drive to make a difference, right? Maybe you're fresh out of uni, bright-eyed and ready to take on the world, or maybe you're thinking, right, I've paid my dues on the wards, time to step it up a gear. Well, the NHS, it's like this massive machine, yeah? And it needs nurses desperately, but not just any nurses who want to climb that ladder, become specialists, the go-to experts. And believe me, it's not all about the money, though that does get better, obviously. It's about respect, about having a real voice, making decisions that actually change things. So, if you're ready to ditch the dead-end job blues and really own your nursing career in the NHS, you're in the right place. We're about to dive into the specialties that are crying out for ambitious nurses like you. Get that notepad ready because this is info you don't want to miss.
First up, we're tackling the backbone of the NHS, adult nursing. Now don't let the name fool you. This isn't just about sticking plasters on grazed knees. We're talking about specializing in the things that really matter. Cardiology, where you're dealing with hearts and lives, literally. Respiratory, where you're the difference between someone taking a breath and, well, you get it. Diabetes, stroke care. These are high stakes, high reward areas. And the career progression? Forget about it. You can climb that ladder from senior nurse right up to nurse consultant, calling the shots, shaping policy. Or maybe you fancy yourself as an advanced nurse practitioner, basically a super nurse, diagnosing, treating the whole shebang. Adult nursing is your launchpad, trust me.
Now, mental health, it's something we don't talk about enough, right? But in the NHS, it's a big deal. And let me tell you, it takes a special kind of person to do this job. We're talking KMAS, working with kids who are struggling, forensic mental health, dealing with the justice system, substance abuse, eating disorders, heavy stuff. But the impact you can have, life-changing. You could become a clinical nurse specialist, the expert everyone turns to, or a mental health nurse consultant influencing policy, fighting for better services. And then there's the ANP route again, that real clinical leadership role. If you're passionate, if you want to make a difference, mental health needs you.
Let's talk about the little ones, yeah? Pediatric nursing, it's not for the faint-hearted. We're talking neonatal, those tiny babies fighting for every breath. Pediatric intensive care, oncology, dealing with the unthinkable. And child protection, being that advocate, that voice for children who need it most. But honestly, the rewards are immense. You could become a senior pediatric nurse running the show, a pediatric nurse practitioner diagnosing and treating, or a consultant nurse in pediatrics, the expert everyone respects. If you've got that way with kids, that genuine compassion, this could be your calling.
Right. Let's talk about bringing life into the world. Midwifery. It's a privilege, isn't it? Being there for that incredible moment. But it's not just cuddles and congratulations. You're talking high-risk pregnancies, navigating tricky situations. Community midwifery, being that friendly face, that pillar of support. Neonatal care, looking after those precious little ones. And then there's maternal-fetal medicine, really specialized stuff. But the career progression? You could become a consultant midwife, a specialist midwife, even a midwifery manager calling the shots. It's about empowering women, advocating for them, making sure they have the best possible experience. If you're passionate about women's health, about making a difference right from the start, midwifery could be the one for you.
Now, district nursing, it's all about getting out there into the community. You're talking about providing care in people's homes, often to the most vulnerable in society. Community palliative care, helping people through their final days with dignity and compassion. Home care nursing, providing essential support to people who need it most. And then there's the community matron role, a real leadership position. And the career paths, you could become a district nurse team leader, a nurse consultant in community health, even an ANP. It's about being that friendly face, that trusted professional, making a real difference in people's lives. If you're a people person, if you thrive on that one-to-one connection, district nursing could be right up your street.
Now, critical care. This is high-pressure, high-intensity stuff. We're talking ICU, CCU, HDU, A&E, the sharp end of the NHS. You need nerves of steel, the ability to think on your feet, and a genuine passion for saving lives. It's about being there in those critical moments, making decisions that could mean the difference between life and death. But the sense of purpose, the camaraderie, it's like nothing else. And the career progression? You could become a senior charge nurse, a critical care nurse consultant, even an ANP in critical care. If you thrive under pressure, if you want to be at the forefront of medicine, this is the specialty for you.
Chapter 7. All right, let's talk about the unsung heroes of the NHS, the ones who make surgery happen. Perioperative nursing, it's all about precision, teamwork, and attention to detail. You could specialize as a scrub nurse, right there in the thick of it, a recovery nurse, helping patients through those crucial post-op hours, or an anesthetic nurse responsible for keeping patients safe and comfortable throughout their surgery. And the career progression? You could become a senior theatre nurse manager, even a perioperative nurse consultant. It's a demanding but incredibly rewarding field, knowing that you're playing a vital role in people's recovery. If you're meticulous, a team player, and have a strong stomach, perioperative nursing could be your calling. Chapter 8. Oncology nursing, it's a tough one, no doubt about it. You're dealing with people facing one of the toughest challenges imaginable, and you need to be their rock, their source of support and information. You could specialize in chemotherapy nursing, administering those powerful drugs, radiotherapy nursing, delivering targeted radiation therapy or palliative care, providing comfort and dignity to those at the end of their journey. But the rewards are immense. You could become a clinical nurse specialist in oncology, an oncology nurse consultant, even a palliative care consultant nurse. It's about being there for people at their most vulnerable, providing expert care and compassion every step of the way. If you're looking for a specialty that's both challenging and deeply rewarding, oncology nursing could be the one for you. Chapter 9. Right, community nursing, it's all about getting out there, being a visible presence in the community and making a real difference to people's lives. You could specialize in health visiting, supporting new parents and young families, school nursing, being that trusted adult for children and teenagers, sexual health nursing, providing confidential advice and support, or public health nursing, promoting health and well-being on a wider scale. And the career progression? You could become a nurse consultant in public health, a senior health visitor, even a community matron. It's about empowering people to take control of their health, providing education, and advocating for better services. If you're passionate about preventative care and making a difference in the community, this could be the specialty for you. Chapter 10. Practice nursing, the cornerstone of primary care. Practice nursing. It's the cornerstone of primary care, the first point of contact for many people seeking medical advice. You're the one who's building relationships, providing ongoing care for chronic conditions like diabetes or asthma, dealing with minor illnesses, and offering family planning advice. You're a jack of all trades, a master of primary care. And the career paths? You could become a senior practice nurse, a nurse practitioner, even a primary care nurse consultant. It's about being that familiar face, that trusted professional who people feel comfortable confiding in. If you enjoy variety, building relationships, and making a difference at the heart of the community, practice nursing could be the perfect fit. Chapter 11. Advanced Nurse Practitioner, ANP. The future of nursing leadership. Now let's talk about the big leagues, yeah? Advanced Nurse Practitioner, or ANP. This is where nursing gets really exciting. You're basically a super nurse diagnosing, treating, prescribing medication, the whole 9 yards. You could specialize in general practice, becoming the go-to person in your local surgery, or emergency care, working on the front lines in A&E pediatrics, mental health. The possibilities are endless. And the career progression, well, you're already at the top of your game, but you can climb even higher. Lead nurse practitioner, consultant nurse, even clinical director. The sky's the limit. If you're ambitious, driven, and ready to take on a real leadership role, becoming an ANP could be your calling. Chapter 12. Research nursing, shaping the future of healthcare. Right, let's get scientific for a minute. Research nursing, it's not for everyone, but if you've got that inquisitive mind, that thirst for knowledge, this could be your jam. You could be involved in clinical trials, testing new drugs and treatments, epidemiology, investigating patterns of disease, or translational research, taking those groundbreaking discoveries from the lab to the bedside. And the career progression? Senior research nurse, nurse research fellow, even nurse consultant in research. You'll be at the forefront of medical advancements. It's about pushing boundaries, challenging the status quo, and ultimately improving patient outcomes. If you're a thinker, an innovator, a problem solver, research nursing could be your calling. Chapter 13. Geriatric nursing, caring for our aging population. Geriatric nursing, it's about caring for our aging population, providing compassionate and specialized care to those who need it most. You're dealing with complex health issues, dementia, frailty, end-of-life care. It's emotionally demanding, but incredibly rewarding. You could specialize in dementia care, becoming an expert in providing person-centered care for those living with cognitive impairment. Or you could focus on palliative care, ensuring that people's final days are filled with dignity and comfort. And then there's the A&P route in geriatrics, taking on a leadership role and shaping the future of care for older adults. If you have a heart for the elderly, a gentle touch and a passion for making a difference in their lives, geriatric nursing could be your calling. Chapter 14. Infection control nursing, protecting patients, saving lives. Right, infection control, it's never been more important, has it? You're on the front lines of preventing and controlling the spread of infections, protecting patients and saving lives. You could specialize in hospital infection control, implementing rigorous hygiene practices and preventing outbreaks. Or you could focus on community infection control, working in public health settings to track and contain infectious diseases. And the career progression? Lead infection control nurse, consultant nurse in infection prevention, even nurse director of infection control. You'll be the go-to expert, shaping policy and leading the fight against infection. If you're meticulous, analytical, and passionate about keeping people safe, this could be the specialty for you. Chapter 15. Your NHS nursing adventure awaits. So there you have it, guys, a rundown of some of the most rewarding and in-demand nursing specialties in the NHS. These aren't just jobs, yeah? These are careers, paths to leadership, to making a real difference. You've got the passion, the drive, the guts to make it happen. These specialties not only offer diverse and rewarding career paths, but also allow you to make a significant impact on patient care and outcomes. Whether you're drawn to the high-pressure environment of the operating room or the one-on-one care of a community setting, there's a specialty out there for you. Consider these options as you plan your nursing career in the NHS and take the next step towards a fulfilling and advanced role. Thank you for watching, and don't forget to like, share and subscribe for more informative content. Now go out there and make the NHS proud.